The term digital seems to be a topic that we frequently hear about in many contexts these days. And that's because we've recently entered a new era in healthcare, and specifically in nursing. We have evolved from automating tasks and documentation into a fully immersive digital experience. I'm so pleased to be able to share just a few of the highlights that every nurse must know in order to navigate this new world. The goal of today is to introduce you to these topics and to give you some pause for how they are applied in your personal career journey and in your own work setting. So please explore these topics further after today's presentation as your own small contribution to advancing digital nursing practice. So let's begin. Some nurses are keen to embrace technology. Others can find it a bit of a nuisance, and still others rarely stop to think about digital tools in their work at all. This presentation explores the skills and the knowledge and the optimal engagement needed for success working in today's digital environment. Every nurse should seek to blend intelligent solutions with their personal clinical expertise. Today, we're going to explore the factors that influence digital nursing, and we will uncover core abilities and understanding necessary for success, no matter if you are just starting your nursing career or if you have been practicing for years. First, what is digital, and why is it so important at this moment in time? It seems like everything these days has been labeled with the term digital. And the term digital, simply put, is a series of values that are strung together by data. Digital is an intelligent application of data manipulation. But what is data? Let's quickly review a few of the core concepts that are studied by informatics nurses because they are relevant to help put digital tools into context, and they're important for every nurse to know. Standalone elements, or data as they are referred to, are actually quite meaningless until they are placed into context, at which point applied data becomes information. With information then, you can use known rules and logic in order to establish knowledge. And understanding the cause and the effect of knowledge and how it applies to other gained knowledge, information, and data is what leads ultimately to wisdom. Digital nursing practice then strives for clinical wisdom by leveraging technology tools and information systems to help manage data, increase information, and to disseminate knowledge in order to improve nursing practice and ultimately patient outcomes. Digital empowers nurses to work more efficiently with enhanced communication, informed decision support, and also to supplement interventions to support optimal patient care. When looking at the modern digital landscape, there are really 6 core drivers for nursing efficiency and rewarding practice. These categories apply to any nurse at any stage in their career and in all practice settings, from the classroom to the home, from the bedside to the boardroom, and even beyond. We are going to explore each of these elements to ensure the best possible partnership between technology and patient care. Nursing is currently at a period of professional shift. As each of these variables continues to influence our world in these unprecedented times, we will learn how to adapt and incorporate each of these successfully and to leverage digital regardless of the stage in our career or our work setting. Because everything digital starts with data, let's begin with analytics. One of the biggest and most valuable assets that digital provides is the ability to help structure and disseminate and interpret massive amounts of healthcare data. It is said that the human brain can perform at most about 1,000 basic operations per second, which is actually 10 million times slower than a computer and also far less precise. As of May 2019, healthcare organizations had seen an explosive growth in data in the data rate at about 800% since 2016 in just 3 short years of time. It is estimated that healthcare data will continue to grow on average 36% annually through 2025. Market research has been shown that global big data in healthcare is expected to reach a $34 billion a year investment by 2022 alone. Contributing to this massive explosion of data is the move from paper to electronic documentation, but also as EMRs continue to evolve and new use cases for clinical data, such as mining for clinical research, continue to be applied. Also contributing are the sheer number of connected technologies and new innovations that are exploding in healthcare. As the world continues to change and our healthcare service lines change, there will also be new means and opportunity of collecting data for the purpose of care. Think of just COVID-19 alone and all of the contact tracing and population profiling we have done to help combat this disease. Additionally, computerized software isn't just software applications anymore. Many times now in healthcare, we actually employ our software as a service, meaning that our systems can more rapidly and accurately process massive amounts of data and complete automated tasks more efficiently than human processing power. While investments in analytics continue to rise, the cost of maintaining large data sets is actually decreasing as we move everything to cloud computing and storage. This is not to say that digital processing power will replace human intelligence, or for that matter, even clinicians. The cognitive capacity for compassion from a person will never be replaced. And the goal with much of this analytics is actually to free up individuals in order for them to provide care so that they can spend less time combing through information in order to make decisions and take action. Nurses practicing at every level and in all specialties should have basic data skills, including an awareness and understanding of the 3 different types of analytics. More and more, developing an eye and a mind for on-demand, in-the-moment processing of information is critical for decision-making as well as for adopting and engaging with machines in order to help share work tasks and to identify developing trends in patients' care. Nurses really need to embrace their role as data architects. The days of manually auditing charts for quality information are being replaced with supportive analytics technology for a more immersive and interactive exchange. The key to analytics in healthcare is the value that digital data can provide. Data is one of the greatest assets we have in nursing, and nurses generate far more clinical data than any other type of clinician. But for too long, nurses have taken a passive role in how this data is used and in establishing a meaningful value for the information that they work so tirelessly every day in order to collect. In a digital world, success is determined by value and creation, by value creation, so more than clinical efficiency. So let me give you an example. If, for an example, you can show how an EMR system generates a medication order and then sends it to an IV pump where a medication is automatically programmed, therefore reducing the possibility of medication delivery errors versus perhaps the number of steps it took in reducing and initiating a new IV on a pump for nursing efficiency, this is really where digital transformation and the mindset starts to shift from counting clicks to calculating the impact of digital nursing and the partnership that needs to exist. To bring value in the future and reduce errors, or even to create an enhanced work environment, nurses need to move from this mindset of data as a byproduct to data as an invaluable partner in completing your work. This relationship, I often say, is nurses embracing digital as the newest member of the care team. Technology is no longer something that we use. Digital tools are among the newest and most influential members of the patient care team. We collaborate, share work tasks, and rely on timely and accurate information for safety measures from these solutions, much like we would rely on our human colleagues. Digital nurses evolved in their data literacy as well, taking foundational data to fuel the demand for patient insight, transparency, risk, and opportunity, and to gain operational business efficiencies that will ultimately refine practice and build out the future. Nurses need to embrace data as an asset and to become statistically savvy, looking beyond dashboard displays in order to incorporate curiosity and to follow clinical hunches. Now, we've all heard of the documentation burden that EMRs introduced, but the more real and emerging concern at this time is the data overload given the massive amounts of information that is collected each day and over the course of a patient's lifetime. The good news is that we now have systems that can easily process large sets of complex data to uncover deep insights and pull out the most relevant and meaningful information, and to solve problems that could not even be possible or identifiable using conventional methods. Also, the evolution of these systems means that data today can be manipulated whether it's been collected as a structured or an unstructured format. Nurses can finally begin to move away from checking boxes and filling out lists to a more realistic collection of assessment documentation. And the goal of big data is ultimately, first, to improve clinical outcomes, also to boost workforce productivity, and finally, to improve the financial revenue of healthcare. It is projected that the big data and analytics revolution and sector in healthcare is likely to be worth $68 billion in business annually due to the usage and investment in workforce management tools, in practice management tools, and also in electronic health records. Data leads to defining value, and value leads to revenue. To achieve this, the 5 main properties of big data must be present: volume, velocity, variety, value, veracity. How much data is there? How fast can it be processed in order to achieve knowledge? What format is the information collected in and stored? And also, can you make an impact or a change with the data that you have on hand? And does this data have merit? Here is a simple example, but a very meaningful one, of big data at its finest. In 2015, a company called Atomwise launched a virtual search using safe and existing medications that could be chemically re-engineered to treat the Ebola virus. They found 2 drug candidates in less than 1 day, a feat that would have taken even the most robust of supercomputers a month-long search in order to process. This was due in part to a new big data revolution known as quantum computing, where the processing power of these machines not only looks at the data contained in the system, but it also runs probabilities against potential options based on what is not yet even known. You are sure to hear more about quantum computing over the next few years. The promise of big data in nursing is limitless. Big data manipulation does not require a statistical degree or any kind of analytical training. In fact, many systems are being developed with a self-service approach so that nurses can dig into massive data sets and clinical repositories from countless different sources using a very simple experience and interface. Better yet, already interpreted big data is likely to be pushed right into the view of nurses in real time in order to assist them in providing care. Imagine the processing power of systems to display a virtual scorecard or a dashboard of outcomes that are specific to you, the nurse, and the care that you are specifically providing to that individual patient in real time. This big data feedback would provide guidance as to where your care may be exceeding or falling short from projected patient care paths or expected clinical outcomes. This harnessing of power of the big data is really the underpinning to how we will display and utilize information for practice in the clinical environment moving forward. The expectation for a completely plug-and-play work experience is clear. Leading the way as the most commonly used digital technology in healthcare are mobile applications. Enabled by application programming interfaces, or APIs as they're commonly referred to, these solutions determine what data formats and conventions are needed in order for different applications to talk to one another. It's essentially an application-to-application communication language so that a digital tool can send out a message and then return a reply using a single application and a seamless experience. For example, if you were to ask your favorite smart speaker device to play music from a certain artist, band, or genre of music, and the app was to respond with a list of songs that you may be interested in listening to. This is using API technology. When applied in healthcare, the power of this real-time support is quite limitless with mobile apps, which are often used to assist nurses with tasks such as language barriers, clinical decision support, and to provide reference information in real time. Connected healthcare technologies don't only come in the form of mobile applications, though. Automated clinical environments are quickly emerging as the new future of personalized digital care. Whether at home, in rehabilitative therapy, outpatient procedures, or admitted stays, the clinical space is transforming to accommodate digital devices to assist with tasks and to gather information and to streamline the experience. Both nurses and patients alike, as well as the families, will interact with this fully digitized space where many different apps and devices are going to work together seamlessly in order to collect, monitor, and notify in real time. This constant collection and stream of data will work with clinical systems such as wearables and mobile applications for a fully immersive and cohesive experience. This type of digital concierge and fully immersive patient experience for families and caregivers and patients, well, really the entire care team, will be individualized and personalized for care, which is really the ultimate goal of all of this technology. Nowhere else will this be truer than in the patient's home, where a sizable proportion of healthcare delivery is now moving towards telehealth. According to a recent American Medical Association report, healthcare professionals are now seeing 50 to 100 times the number of patients via telehealth than they did before the coronavirus pandemic. The report notes that 46% of patients are now using these types of telehealth visits to replace canceled in-person visits, and they are not looking back. This is up from 11% of patients who use telehealth technologies in 2019. Virtual patient visits alone have tripled in usage in 2020, and the number continues to rise. Nurses have been at the center of these visits, and where patients have been historically skeptical of adopting this type of visit, they have now come to embrace it with the full convenience and efficiency and the personal connection that they're beginning to feel with their care team as a result of these types of experiences. It is 5 times faster now to schedule a virtual visit with a provider than an in-person one. Telehealth introduces a whole new set of nursing skills and knowledge to prepare our workforce to gain proficiencies with these tools. Nurses now need to consider things like on-screen personas, body language, lighting, and sound. They become on-site technical support for patients and families and for one another to walk through internet connections, enabling or disabling online features, and trying to create the best possible visit experience. These topics never really came up in nursing preparations or in discussions even one short year ago. But telehealth no doubt is here to stay, and the demand in all specialties for nursing care to continue in this platform is on the rise. Also, for those nurses who don't practice at the bedside, our workspaces and practices will also continue to change as well as we learn to adapt to online learning platforms, virtual meeting spaces, and remote work assignments. Speaking of remote, together with telehealth, remote care and monitoring has also taken off. The dynamic of care teams is shifting to maintain efficiency and to also continue to provide care to clinical patient access amid staffing shortages and budget restrictions. Caregivers need to work together completely differently than they ever have before, including adding remote monitoring and e-health capabilities. Many sites now employ some form of synchronous or asynchronous monitoring of patient care for both inpatient and ambulatory settings. Home care nurses, for example, have found that follow-up visits and wellness checks can shift from about 5 to 10 patients a day in the home to a call center approach where they can monitor 80 up to 100 patients at one time. The nurse picture here in this slide is from Mercy Virtual Care Center in St. Louis, which opened its doors in 2015 and is self-described as the world's first hospital without beds. Using highly sensitive two-way cameras, online-enabled instruments, and real-time vital signs, clinicians are able to see patients exactly where they are. They have virtual visits and they monitor hundreds of patients across 43 different hospitals in 5 states, 24/7, 365 days a year. Forecasts for remote monitoring technology, jobs, and digital applications are anticipated to grow about 8% or more year over year between 2020 and 2027. So some of the research that we're just starting to look at for nursing includes skills and characteristics that are needed to support digital nurses behind the screen from remote locations, and how they're supposed to leverage the power of artificial intelligence in developing predictive logic and to help them spot changes in patient conditions even before the human eye can detect them. There are 3 basic areas to consider for nurses as they begin to further explore use cases for remote monitoring technologies. And that is, what device is going to be used in the remote monitoring scenario? For example, will it be a proof of life device that detects patient breaths by movement of air within the room? Or a hemodynamic monitoring piece of equipment, or point of care testing, and so on. Also, how will the application from the remote capabilities be employed? Will it be used to monitor fitness, such as gait stability while walking, or chronic disease management, such as cardiovascular disease? Or will it be used for behavioral modification, for reinforcement, for safe patient care? Finally, where will the remote monitoring be applied? Will it be in a home care setting, or a long-term care facility, or a hospital? Each of these different variables holds more information that nurses need to begin to have a dialogue against as we begin to stand up additional remote capabilities. Feeding into much of our connected world are the new technologies that are being developed to align healthcare to the rest of the growing technology market, as well as to reform some of our outdated and manual processes. Healthcare has always been a little bit slower than most industries to adapt new solutions into practice because of the complexities and the lack of standardization that we have as a discipline. But industry is quickly figuring out ways to assist us with this transformation. In order for something to be considered emerging technology, it has to be a solution that hasn't quite hit mainstream practice yet, as well as cause positive disruption in the way that things are currently done. Dozens of emerging technologies exist in healthcare, impacting business operations and financials and access to care. Today, we're going to focus on just a small handful of items that have the greatest potential when applied within nursing. Now, underpinning much and almost all of this emerging technology is artificial intelligence. Artificial intelligence and machine learning operate in an intentional and adaptive manner. They leverage intelligent systems and applied logic in order to identify trends and patterns and to help make recommendations or to provide answers. So AI systems evolve with the ability to learn and improve in their algorithmic decision-making as new information and patterns are recognized. A recent study of chief information officers found that they believe that AI will replace about 1/5 of human tasks within the next 5 years. This is not to say that AI is going to replace humans. Healthcare will always have rich problems to solve that require human brain power and empathetic interactions. But the impact on nursing to move individuals to practice to the top of their licensure and remove tasks that otherwise would be required to take up their time is really what all of this effort is being put forward towards. Imagine a world where we can accurately and in real time predict the staffing needs of a hospital based on the exact patient makeup of the patients in-house. AI has the power to complete these types of routine tasks, as well as detailed oriented tasks, in order to free up manpower and to focus on clinical care. Now, the Internet of Things, or IoT as it is commonly referred to, describes a network of items that have embedded sensors and software and other technologies for the purpose of connecting and exchanging data with other devices and systems over the Internet. So Much of our connected medical devices, telehealth equipment, and wearable technology would all fall into this category. And this is a great category to really represent digital, as it typically houses a lot of the items that we think about when we hear the term digital. Now, that being said, many nurses often mistake these types of solutions with simply being medical equipment, instead of looking at them as connected digital tools. Think, for example, of nurse call light systems and refrigerator monitors for medication and specimen inventory management. Nurses seldom stop to think about how these items inform their care practices, but when these systems fail, they can have major consequences and implications on nursing care. Connected devices are one of the fastest and most growing areas of innovation in healthcare. And common discussion topics that come up for nursing in this category include mobile technologies, smart devices, bring your own device to work solutions, and a lot of others. IoT enables nurses to be more watchful and respond proactively. IoT devices are really a new part of our workforce, or what I like to call the task wizards in a digital era. Integrating our work assignments with these tools will continue to be transformational as we evolve digital nursing care. Probably one of the easiest emerging technologies for nurses to envision is the use of robotics. And it is often associated with supply-related tasks, but robotics really offers a lot more promise for minimizing extra steps and labor for our nurses. And this is especially critical with an aging nursing workforce as this technology continues to advance. We're going to start to see more humanoid types of experiences and voice activation and robots that have emotional intelligence logic built in. These robots are already growing in use case in Japan, where 40% of all robots today are made. And their use cases in healthcare are also growing there, and they are driven much like ours due to the anticipated workforce shortages. In fact, worldwide industrial robot growth has increased from about 1 million robots in 2000 to 9 million just one decade later in 2010. By 2025, it is estimated that there will be approximately 1.5 billion robots commercially in use by consumers and industry worldwide. And for those of you who enjoy imagining a future and what it will look like, it is also estimated that by 2030, robots could outnumber human workers in certain sectors of industry. Once again, I want to emphasize that this is not to say that nursing jobs are going to be replaced by robots, but they certainly will be aided and assisted with the aid of these digital care environments and these tools as we evolve and adopt this technology in our practice. Immersive technologies are a little less common than robotics, but they do hold major potential for education, clinical practice, and patient care. There are three major categories of immersive technologies that are packaged together and often referred to as extended reality, or XR. Virtual reality transports an individual into a completely digital created environment. Augmented reality then superimposes digital data onto a real environment to give a more realistic feel. And mixed reality blends the best of both worlds, combining physical and digital environments and objects to coexist and interact with one another. Now, many studies have shown that there is tremendous benefits to using this type of immersive technology. And these benefits can include things like positively enhancing skill coordination and learning experiences for individuals, as well as improving learning outcomes. This type of technology can also strengthen cognitive and psychomotor abilities, as well as improve post-intervention skills and knowledge. These technologies also enhance the ability to vary perception and improve decision-making and prolong retention while shortening the learning curve. This is often technology that is commonly used in university settings as well as in clinical education. In fact, Harvard University has completely done away with some of their lecture style formats in favor of allowing their students to kind of work in a self-paced, simulated, immersive environment. And no doubt, having these types of alternative digital environments will help streamline clinical education in the future. But did you realize that this type of technology is also incredibly helpful for patient education as well? At Boston Children's, they use 3D virtual reality tours of colonoscopies and endoscopies to allow their patients to experience procedures exactly as their clinicians did. So a patient uses their very own smartphone to scan a barcode, and then they watch a virtual tour of the insides of their bodies during the post-procedure findings and education session with them. There are many other use cases that are also being explored, such as pain management to help transport patients to a sandy beach for relaxation, but also in behavioral health in managing anxious patients during inpatient stays. Moving caregivers and patients into these virtual immersive experiences is no doubt going to become the way of the future for adult learning and education. Now, in order for machines to actually move closer to human level understanding, they need to get past one of the semantics around communication, and they need to be able to understand unstructured spoken language. Thankfully, our consumer market has really exploded in this area over the last couple of years and has helped pave the way for healthcare. This technology is now making its way into clinical care settings, and shortly, very shortly, you will start to see both nurses and patients alike using this type of voice assistive solutions with questions and inquiries, and they're also going to help them with tasks throughout their day. So imagine a time when a nurse can walk into a patient room and talk naturally in the room while the device not only answers their questions, but also automatically records their documentation on their behalf into the EMR simply as they're talking with the patient. Nurses will be able to ask for assistance with setting alarms and reminders or to complete a task for patient care. And patients too will start to use this technology as they will ask what time lunch is at, or when their next scheduled procedure is, or even when the physician thinks that they can go home. Having this immediate on-demand ability to query clinical information systems for real-time information answers and support is a game changer. And this is technology that is literally on the horizon that you will start to see not only in the next couple of years, but in the next couple of months in widespread usage in healthcare. Now, part of the reason that healthcare has been slower to adopt this technology is that we use a lot of different medical terms and expressions and contexts for what we mean. And so there's a lot of complexity in medical communications. The underlying intelligence of these systems really needs to be developed to be smart enough to decipher between statements like the patient is a non-smoker, meaning the same exact thing as denies tobacco use. Or these systems need to be able to determine the difference between a term, a medical term that's used in two different ways. For example, diagnosed with diabetes, meaning something different than no family history of diabetes. Chatbot technology is another form of natural language processing, and it is further along in the programming logic in use cases in healthcare. Shown here in this mobile app picture, you can see that it can either use digital text or live text to speech in order to engage in an exchange. This software is commonly used to conduct online chat conversations in lieu of providing direct contact with a human agent. And healthcare organizations will use this type of tool in the future to gather real-time information about patient experience in order to supply immediate service. This technology will likely replace historical service lines and help desks for clinician support. Really, the possibility for chatbots is rich with opportunity, and we are going to see many more use cases emerge in probably the next 2 to 3 years. Perhaps the most pressing of all the digital topics for nursing is actually cybersecurity. This topic alone could take a standalone presentation to unpack, but we're going to go over the most relevant detail for all nurses to apply and use caution when using digital technologies. Cybersecurity is the largest and most impactful threat to health delivery. According to the latest research, healthcare organizations have found that 75% have experienced some sort of cyber attack. 53% of these organizations have been attacked within the last 12 months alone, and these are validated attacks. Dozens, if not hundreds, of attempted attacks are monitored each day throughout the world against healthcare organizations. Downstream devastation from one attack alone can cost a single organization millions of dollars, loss in system productivity, inability to access essential information, and failure to coordinate and communicate communicate effectively and freely between care team members. Increasingly, the most important cybercrimes undermine trust between patients and care organizations, threatening privacy, safety, access, and ultimately imposing huge costs on care. Trust is the foundation for successful and sustainable business, and this trust is instilled and supported through the aid of digital technology. Trust influences consumers' perception of their care. The consumer relationship depends on complex and often invisible connected technologies in order to maintain trust. People instinctively distrust things that they cannot see, feel, or understand, making nurses essential in the fight against cybercrime and instilling confidence. Our profession is no doubt the most trusted in healthcare, putting us at the forefront to help combat some of these key tactics is essential in fighting off these attacks. The 5 Ps that ultimately drive consumer choice in healthcare include product, price, promotion, place, and now, importantly, privacy. Having a comprehensive strategy is essential, and nurses should take time to familiarize themselves with the strategy for their organization and exercise competence around healthy online practices. Because healthcare offers critical life-saving services, criminals and cyber threat actors look to exploit vulnerabilities. Every day, new cybercrime techniques are being developed in order to attack healthcare organizations. Cyber attacks can have ramifications beyond financial loss or breach of privacy. And we're going to explore 4 types of attacks that nurses will likely encounter within their practice. First is fraud. This is often referred to as the billion-dollar scam by the FBI because it's actually the easiest to pull off, and it's the one that people are most likely to fall for. Also referred to as phishing schemes, these attacks come in many forms. Business email scammers use spoofed email to compromise accounts or to trick employees into allowing access into an organization's secure network or to disclose information inadvertently. Most commonly, these attacks happen in one of 3 ways. Either a clinician will click on a phishing email that contains a malicious attachment, they'll click on a malicious link, or they will view an advertisement containing malware, or this is also called malvertising. The scammers almost always pretend to be a person of power within the organization, like a CEO or a CNO. And these types of scams have increased over 1,000% since 2015 alone. And the reason they're so successful is that these cyber criminals, they do their homework. They research their targets to know how to sound, and they mimic individuals that they're generally trying to portray. Ransomware is the second type of attack that we often see, and this one is growing as well in intensity. It's a type of malware or software that is intended to do harm. It infects system files and it renders them inaccessible until a ransom is paid. So it essentially locks you out of your systems. A growing number of ransomware attacks have happened in healthcare, and the rate at which these attacks are happening is actually very alarming. When this occurs, the healthcare industry, critical processes, and care are slowed and almost can be incapacitated. Hospitals often are forced to go back to utilizing pen and paper without any form of automated communication. Access to files and medical equipment are blocked, including items that you wouldn't normally think about, like medication dispensing cabinets. Really, any device on your network, which essentially provides information, needs to be stopped. And then medical care and business operations are also stopped in their tracks. While nursing cannot independently fight these types of attacks on their own, they should be aware of how to use encrypted antivirus software and proper information protocols for their organization. They also need to maintain backup processes and practice downtime drills, as well as maintain mission critical paperwork and practice documents such as policies as part of a routine simulation of what you would do if you were not able to if you had to provide care without any form of technology for greater than a 24-hour period of time. Now, data breaches, interestingly, are a type of cyber threat that can either be accidental or purposeful in terms of disclosure of personal health information. The health industry experiences more data breaches than any other sector. Breaches can be internal or external, including third-party vendors who work with healthcare organizations. And most federal laws actually hold the healthcare organization, not the third-party vendor, ultimately responsible when information breaches occur. While an insider may simply be careless in leading to a breach, others cause destruction because of malice. And breaches observed in healthcare include credential stealing, malware. It also includes insiders who disclose patient data, whether on purpose or inadvertently, verbally or digitally. Also, it includes lost devices with patient or organizational information stored on them. Now, these breaches occur when forwarding or sharing of unencrypted emails occurs, and personal health information can actually become more valuable on the black market than even credit card credentials. Therefore, it's a higher incentive for cyber criminals to target these types of medical databases. In fact, over 15 million records have been compromised in healthcare data breaches as of early 2020, according to a new Health and Human Services breach report. Now, the average cost of a data breach incurred in a non-healthcare related agency per stolen record is about $158. For healthcare, though, the average is about $355. Credit card information sells for about $1 to $2 on the black market, but PHI, or protected health information, can sell for upwards of $360. And that's really because someone's personal health information, their history, their ailments, surgeries, or illnesses, it can't be changed, unlike a credit card or social security number. So PHI becomes very valuable because criminals can use it to target victims with fraud scams and take advantage of medical conditions or victim settlements. It also can be used to file fake insurance claims or allow the purchase and resale of medical equipment, or even to illegally gain access to prescription medications for resale on the black market. The federal HIPAA security rule requires that health service providers protect electronic health records using proper physical and electronic safeguards in order to ensure safety in health information. Breaches of over 500 records, whether due to hacking or accidental disclosure or lost or stolen devices, or even unauthorized internal access from within an organization, or even ransomware, are now required to be reported. And then finally, we have distributed denial of service attacks, or DDoS. These are popular tactics by hacktivists and cyber criminals who have some sort of political or ideological gain that they're trying to achieve. The goal of these types of attacks is to overwhelm a network to the point of interoperability. So while some DDoS attacks are opportunistic, many times they target victims because, again, social, political, ideological, or financially, they're looking to gain from the system. Perhaps the most well-publicized case of this happened in 2014 when Boston Children's Hospital was attacked by Anonymous, which is a well-known hacktivist group, which targeted the hospital after a 14-year-old girl was admitted to a ward as custody of the state when custody from her parents was withdrawn. The parents took to social media, which is how Anonymous picked up on the story. Now, the doctors believe that the child's ailment was actually psychological, and that the parents were pushing for unnecessary treatment for a disorder that the child didn't have. The custody debate put Boston Children's Hospital in the middle of a very controversial case and made this patient's case very public. Now, without sharing any medical details with the public, Anonymous viewed this as an infringement on the girl's rights. They didn't have all the information, and they were out to attack the hospital. Anonymous took action by conducting a DDoS attack against the hospital. Think of it as a massive spamware attack, and it took down every aspect of the network, which resulted not only in that hospital but others, including Harvard University and all of its hospitals, to lose their internet access as well because they had shared systems and different connections throughout their network. The networks experienced an outage for almost a week, and some of the medical patients and personnel could not use their online accounts to check appointments, test results, or even other case information. Ultimately, the Boston Children's Hospital ended up spending over $300,000 to respond and mitigate to the damage of the attacks. And as our world becomes more transparent with people, we will infer that the quality of care and making people's opinions public can definitely become part of our world as we try to defend against cyber attacks. And ultimately, this can be so damaging, not only to halting patient care in its tracks, but also to the reputation of organizations. Strong hygiene practices are the cornerstone of successful prevention and spread of many diseases in healthcare, and cyber hygiene is actually no different in preventing the fight against virtual viruses and attacks. This problem is much like a physical problem, and it's really not a digital one. Consumers' trust in healthcare relies on essential hygiene practices, and the greatest asset that we have in healthcare is also the greatest threat that we have to our security, and that is our own caregivers. Every day, completely well-intentioned, compassionate individuals place their organizations in immense risk for cyber attacks simply through poor cyber hygiene practices. Many organizations now employ the role of a C-suite executive known as a Chief Information Security Officer or a Chief Digital Officer in order to assist corporate compliance, legal, and IT in planning strategies and putting things in place to help thwart these types of attacks, and also, more importantly, to be a resource and educate caregivers and to perform practice drills in order to secure the virtual borders of our care environments. 91% of technology leaders agree that data privacy and trust will be as important as the services we provide clinically over the next few years. It takes only one data breach for consumers to lose trust in an entire organization. Detection and prevention of threats is only one piece of good cybersecurity strategy, but it's reactionary. Preventative cyber hygiene practices are the most essential actions we can take as caregivers. And once again, nurses are key to performing this practice. Prevention measures are part of physical security, and it takes the form of protecting us in our three greatest areas of weakness. And that includes data theft or loss, infection of integrated devices, and also password protection on our network. Online behavior etiquette doesn't just reside with security-related topics. Individual practices and activity online are a major consideration for today's nursing workforce. The nursing workforce is rapidly changing, and at this moment in time, we have 5 different generations in the workplace with vastly different approaches to technology. No doubt one's expectations of technology vary based on their historical relationship to it, and there's no way to put any one group of nurses into a generational box. But we do know that, like anything else, the more exposure someone has to digital tools, the more likely they are to seamlessly incorporate them into both their personal and their work life. Earlier generations really helped pave the way for understanding the human-machine relationship dynamic. We learned about ergonomics, usability, and portability from these earliest days of automation in healthcare, so that in today's digital environment, these elements are considered standards. Nurses who are entering the workforce currently are the generation that are most likely to transform the digital nursing experience. These nurses are the ones who can envision digital tools and use cases to position the profession for the future and to solve the challenges ahead. As we move towards a future that is projected to have a shortage of nurses to care for an aging population, it will be more and more critical than ever to have strong nurse-digital partnerships, especially as care moves outside of brick and mortar traditional care facilities into the home and into virtual spaces. No doubt the generational difference also impacts the future direction of healthcare as we move from prevention to wellness in an effort to be more proactive and cost-effective with our healthcare. Care is moving out of the hospitals, as we have said, into the home, and the caregiver dynamic is also shifting from a nurse-patient partnership to one with families and other non-traditional care support individuals within the community. Digital will no doubt play a big role in this changing dynamic. As much as 80% of what affects health outcomes is associated with factors outside of the traditional boundaries of healthcare. Social determinants of health, such as behavioral habits, social, economic, and the environment, all play a role in these outcomes. In order to enhance patient care and engage individuals in a proactive role in their care, these topics must be considered in the global digital plan for population health reform. Public health and epidemiological nurses, as well as our advanced practice nurses, play a critical role in the future of digital nursing care. Healthcare delivery systems need to build the skills to interact with and develop health intervention strategies, partnering with law enforcement, social support services, and the community. Tracking job growth, economic development, healthy lifestyles, violent crime, and environmental changes will become a part of our digital care ecosystem. One of the collateral and unexpected benefits of COVID-19 is a more focused effort on infectious disease in our communities. Riding this momentum, nurses should set new forums for digital and virtual connections in this space to help manage chronic conditions and to help with healthy communities, starting with patient-reported outcomes and social determinants of health data. These items will aid in achieving a value-based care. Healthcare reform is also helping in this area. New collaboration and documentation skills will become critical because data collected for care will no longer just be for the clinical care teams. Patients and payers will become partners in the healthcare workforce and will have access to all of this information. Thinking about how we will train our caregivers to focus on these areas will be much of the work that is ahead of us in the nursing strategy over the next decade. Now, our world is more personalized than ever before, with the help of digital technologies and social media. These apps are enabling connectivity, networking, and individual brand sharing for nurses for both a personal and a professional level. Successful online engagement is, in fact, blurring the lines between personal interests and philosophies with professional presence and polish. Nurses must recognize both their ethical and legal obligation to maintain patient privacy and confidentiality at all times. Healthcare HR-related issues and nurse terminations have risen dramatically over the last 5 years, due mostly in part to personal misconduct on social media sites. This includes unlicensed nursing staff as well as students. Online conduct has now been written into the Code of Professional Conduct and policies for most organizations and also for universities. So mindfulness of personal opinions, images, and affiliated networks related to your employer, a coworker, or a customer are all considered terminable offenses and also potentially legal ones. Even if you are not the author of a posting, but you comment or like something offensive, you may find yourself in disciplinary action. Understanding also who you are friending and allowing into your social network is the nurse's responsibility. Many nurses have friended patients and families after long and very personal journeys with them, which have established really rewarding and cherished relationships with these individuals. But on the flip side, other nurses have been devastated to find out that a patient or a family member has posted a negative photo or a secret video recording or comments about their personal nursing care on social media as a way of virtually reviewing them in a very, very public forum. Some of the most common reports to the Board of Nursing around personal postings by nurses themselves on social media include inappropriate disclosures that fall into the following categories. And these numbers continue to rise as well. There are really 4 common misbeliefs that nurses have around social media that really often get them into trouble from an HR perspective. First, there's a mistaken belief that the communication or the post is private and accessible only to the intended recipient. Also, that mistaken belief that the content has been deleted somehow from a site and is no longer accessible if a post is taken down. Third, a mistaken belief that that information is harmless if it's private information about patients that is not disclosed in the communication, such as a specific name or a diagnosis for an intended recipient. This is still considered a breach of confidentiality, even if PHI is not released. Also, a mistaken belief that it's acceptable to discuss or refer to patients by name or nickname or with some other identifier that is not directly tied to, but insinuating a relationship with a specific person. So switching gears a bit, it's now common for HR to consider social media posting in their hiring practice as part of a mainstream part of what they do. They look at media pages and online branding for professional characteristics in terms of what is a best fit for a specific role and for a specific organization. In fact, IBM's supercomputer Watson developed an AI algorithm to digitally profile individual nurses based on their social media presence and postings in order to determine who is most likely to be a good hire in terms of longevity, organizational loyalty, and a cultural fit, and the skill set and their own personal skill set by combing social media pages and demographic information. So in a digital world, things like paper resumes are becoming static and outdated. It is common now for hiring managers to review online profiles, your recent postings, hits to your pages, and other comments, whether professional or personal. And this is how they will formulate a perception of a candidate prior to ever bringing them in for interviews. Social media is a great tool for personal and professional sharing and branding. While it has become a new standard on the hiring side, we still have a little bit of a ways to go with nurses embracing this as a powerful tool and as a work standard. Ensuring a keen understanding of personal responsibilities and exercising professionalism for all online activity is the best skill for nurses to exercise as we move towards greater adoption of networking and marketing potential contained within these platforms, so that nurses can really leverage these tools to more effectively share and collaborate digitally. And now for our final digital trend, to treat IT like a business. This means streamlining the supply and demand while keeping the main focus on the bottom line. Leading organizations create new business by developing a disciplined effort around technology installations and performance monitoring tools. As a result, continuous improvement models have been the focus of IT over the last several years. Many healthcare organizations focus on value improvement and strategic business practices while engaging with their digital vendors and technology teams. Agility and speed, rapid iteration, and minimum viable solutions that can later be improved upon have all been introduced into healthcare as a way of managing the digital transformation. Kaizen boards, Gemba walks, and many other global business improvement strategies have been deployed to assist on this journey. The IT relationship in healthcare and the overall partnership with the business has in fact begun to change. Almost 2/3 of organizations, or 64%, really encourage some sort or form of shadow IT. Shadow IT is a somewhat dark term that IT professionals have developed in order to describe a new phenomenon, which is the transfer of power and influence from historic IT roles and responsibilities over to the business and clinical end. Technology leaders are increasingly collaborating with business peers to help set priorities and execute large-scale initiatives. And this has resulted in much higher clinician experience, as well as dramatically faster time to deploy new solutions and ultimately better solutions in terms of addressing clinical need. Having clinician-driven IT models also helps to increase digital technology innovation in healthcare. It helps organizations to gain market share, and it reduces costs by improving operational outcomes better than traditional IT approaches. Engaging the business in digital deployments also helps to improve key objective performance measures and to more closely align technology to the organizational strategy. We have moved away from the days of IT guiding the business and the technology budget priorities to a shift where business stakeholders are informing IT with the strategy. Now, one of the byproducts of this shift is that clinical leaders must stay more engaged and informed in technology-related topics, and nurse leaders and educators alike are no exception. They are needed to aid nurses in the participation of technology discussions, in optimization, and in helping to set the digital strategy. This is truly where having a strong nursing and clinical informatics team helps to benefit many organizations in today's world. Digital nurse leaders often think about the end product versus the IT project. They enter these discussions with a mindset of transformation versus technology implementation, and they bring in cross-functional teams to help address the need, which is ultimately what aids in the success. Additionally, nursing has a workforce bench strength that, unfortunately, the IT sector simply does not have. Currently, there are 67% shortages in skilled IT professionals around the globe, and only 22% of technology experts are women, a number that has remained relatively unchanged for the last few years. There has been no increase, unfortunately, in female technology leaders since before 2018, when the percentage of women in healthcare IT leader roles was at 12%, exactly where this statistic sits today. Now, this is not to say that nurses need to change disciplines or migrate over into IT leadership roles. What this means is that nursing has a tremendous opportunity to step up into informal digital leader positions and to drive business performance for patients and caregiver experience, and ultimately for just better solutions. They can enhance collaboration and engagement at all levels across all care settings. This now concludes today's discussion on digital nursing practice. Hopefully, these topics resonate with you and your work and have inspired you to spend more time looking for opportunities to innovate and incorporate technology into your own professional experiences. On behalf of the entire Cleveland Clinic Nursing Institute, I would like to thank you for your time and attention in addressing this most important topic with us today. Thank you.